Okay, so we will go ahead and get started. Again, my name's Christy. I'm a GCAP trainer with San Diego PACE. Thank you for joining in this afternoon. We're going to present on managing aggressive behaviors. Throughout the presentation, my camera will be off, just so there's no delay in Teams. But the chat will be open, so sometimes we have questions, or I'll ask a question and you can participate in the chat. Thank you. So again, today's presentation is on managing aggressive behaviors. We're going to go over what aggressive behavior is, identify potential triggers and some warning signs. We'll go over some de-escalation skills. So aggressive behavior is any behavior or act that is aimed to oppose or harm. This can include shouting or outbursts, swearing or harsh language, threats, hitting, kicking, biting, or spitting. What do we think some potential triggers are for aggressive behaviors? You can go ahead and answer in the chat. Think of when you're working with patients or the people that you take care of or relatives. What do you think could be a trigger for them to start having some aggressive behavior? So some potential triggers for aggressive behavior can be pain. Sometimes our participants, our patients, our loved ones, they're unable to vocally tell us when they're in pain, so they might start having some shouting, kicking, just because they verbally can't tell us. The loss of a loved one, frustration, either they're unable to communicate, they're frustrated in whatever situation they're in, so they may start to behave aggressively. Memory issues or trouble remembering details. Uncomfortable, busy environments. This could be at like an adult day center. This could be out and about at a grocery store, but basically where a lot of people are, or a lot of noise out in public. Hungry or thirsty, again, so if they're unable to vocally tell us that they're hungry or thirsty, they might start to become frustrated or irritated, or just act aggressively. If they're having difficulty expressing themselves, a lack of sleep. I'm sure many of us know that if we don't get a good night's sleep, we might not be a good example of our best behavior the next day. And again, loud noises. So we want to pay attention to why the individual may be frustrated, not just the behavior, but what can be causing this behavior, because it's going to help us in managing the behavior in the future or preventing that behavior in the future. This we would do in our in-person training, but basically we'd have someone try to read this question. As you can see, you're not able to understand the question, right? So we repeat it. Again, probably not able to understand that question. Basically, we were asking the individual, what do you want to eat tonight? So how do you feel if you're the individual on one hand trying to understand what the caregiver is asking, but you can't understand them, you're having some difficulty, or the caregiver having to repeat the question and repeat the question might also begin to feel frustrated. A lot of times, aggressive behavior will start having warning signs leading up to that behavior. The person may begin pacing. They might start to raise their tone of speaking loudly. They may even become restless. So restless and pacing, this can go from shifting weight in their chair, becoming uncomfortable. They might be going from a chair to maybe a couch if you're in a home environment, or changing the room and they just can't get comfortable. Clenched fists, it's not always just both fists clenched. They could be grasping their walker tightly, their chair tightly. They could have their hands together very tightly, or profanity. Our loved ones or our patients sometimes use profanity in normal conversation, but if they start to use it a lot more in the conversation while changing their tone of voice or speaking loudly, this could be a warning sign leading up to aggressive behavior. So we all know with Alzheimer's and dementia, their reality is not the same as our reality. Alzheimer's and dementia basically distorts the person's reality. What we see as delusion or delusional is actually the world they're living in. And a lot of times those outbursts from individuals with dementia or Alzheimer's, they might not have those same warning signs like we discussed. Maybe the same triggers like a loud environment, or they're in pain, or they're hungry or thirsty, but a lot of times it's not going to lead up with pacing or clenching their fist or just the tone of voice changing. Usually with dementia or Alzheimer's, those mood and behavioral changes are pretty rapid. So we can say, 0 to 100 very quickly. They start to get agitated or confused, or the confusion leads to agitation. Um, the height of the heightened emotion can start and end very rapidly, which makes these situations especially difficult to manage. There's no one size fits all solutions with managing aggressive behavior. You may try something with one person, and then try it with somebody else that has the same diagnosis, same triggers, same warning signs, could be same gender, same medical history, but it doesn't mean that it's always going to work with a different person the same way. Even with the same person, they may have some aggressive behaviors in the morning. Maybe you were able to de-escalate it one way. However, now in the afternoon, they are upset for a different reason or having these aggressive behaviors. And that de-escalation technique from the morning might not work in the afternoon. So there's no one size fits all. What we mean by de-escalating, so de-escalating is the opposite of escalation, seriously. An escalation would be an increase in extent, volume, number, amount, intensity, or the scope. We use these de-escalation techniques and skills as an intervention to potentially dangerous situations or environments. And de-escalation is a strategy that helps us to build rapport or trust with the agitated person so that we can avoid further escalation or even violence depending on the situation. If the environment is deemed dangerous, then we're going to start using crisis intervention, whether that means calling 911 depending on the crisis, clearing the area. If we need to, if there's other family members, participants, patients, staff, depending on where you're working at. We might need to clear the area. We might even need to remove ourselves from the area if it's dangerous. So depending on the situation, you might have to start with crisis intervention. But usually when we start noticing these warning signs or the aggressive behavior starts, we want to try to de-escalate it as quickly as possible, because when it's used early, that's when it's most effective. We shouldn't be waiting until somebody is totally aggressive, being violent, kicking, shouting, spitting, to start de-escalating. We want to try to de-escalate it earlier than later. So when should we try to de-escalate? Either we noticed some warning signs, they were pacing, they were changing their tone of voice, they started to speak very loudly or clench their fists or become restless. If there's ever an immediate safety hazard present, we would want to try to de-escalate. Repeated inappropriate behavior, physical or sexual harassment, or if there's any verbal abuse, slurs, or vulgar language. At PACE, we don't tolerate these behaviors, so they have to be reported immediately. Depending if you're a caregiver working with an agency, these may be reported directly to your supervisor or scheduler at the agency, or if you're working directly with the family, maybe you're reporting them to the family member. We have something called HEARD. So basically, the first stands for here. So we want to ascertain the issue through active listening. We're going to use our active listening, our eye contact, nodding, gestures, basically that we're actually hearing the person out, and we want to hear what their concern is or what caused them to become agitated or aggressive. The second letter E is for empathize. So we want to express our understanding. Understanding doesn't mean that you feel the same way, doesn't mean that you're upset with them, that you're sad with them. It's simply understanding that they feel the way they're feeling for whatever scenario is going on. So we want to hear what the issue is. We want to empathize that we understand they're feeling some kind of way. And then third is the letter A, which is acknowledge. So when we acknowledge, we want to summarize the issue in our own words. They told us they're upset because the person next to them is speaking loudly or talking too much, for example. So we want to repeat that back to them. Oh, okay, I understand that you are feeling upset because the person next to you is speaking very loudly. You're unable to focus, I don't know, on a crossword puzzle. Or the person next to you is continues to speak and you kind of want a quieter environment. So we're summarizing the issue basically to let them know that we were listening and also to make sure that we have the issue correct, because maybe we heard that that was the issue, however, there was something leading up to that. So we can get to the bottom of whatever the actual issue is. Um, Next is the letter R. This stands for resolve. So we're going to propose a solution. So the person next to you is speaking so loudly or speaking too much. How about we move to a different area if we're able? If this was in like one of our day centers, we might take this person outside for a walk to get some air. Or if they had an appointment, maybe we're going to the back for that appointment. But basically trying to find a solution or to get them out of whatever scenario that they're in. Then 5 is to diagnose and seek the root of the issue. So if this person speaking loudly was the actual issue, maybe one of the person's triggers is a noisy environment, and we're going to a doctor's office that we know is going to be noisy. In order to manage that behavior in the future, maybe we're scheduling our appointment times when the office isn't as busy and not during their peak hours or something like that. Um, if this was out of hunger or thirst, maybe we're tracking down a good schedule for feeding or drinking. So it kind of depends on what the actual issue is, but we want to seek out the actual root of the issue so that we can manage future aggressive behaviors and prevent them. So again, that's heard, hearing, empathizing, acknowledging, resolving, and diagnosing. So in our in-person trainings, we actually work together in groups to try to practice heard. If you want, this is something that you can do at home or with your friends to get better at this. Getting better does take practice. We have to learn maybe not to become defensive with someone's aggressive or starting to show aggressive behaviors, but rather we need to learn to listen, to empathize, to acknowledge whatever the situation is, propose solutions, and then work together to kind of figure out what the actual issue is. So if you want to practice this with friends or family members, if there's more than one family member that takes care of the person or caregivers, one person is going to tell a time when they were frustrated to the other person. That other person is going to practice listening, empathizing, and acknowledging. and then you can switch. But that is something good to practice with each other just to learn from it. Whenever we're in an escalated situation and we're trying to de-escalate, the first thing you want to remember is to remain calm. You only want to focus on the variable that you can control. So you can't control sometimes that person's emotions or the reaction to the emotion, but you can control how you respond and react yourself. You want to try to remain positive with a calm demeanor. If you start to become negative or you start to show signs of aggression or that you're being defensive, that can further escalate the situation. And you want to use a soft, stable tone of voice. So again, if your tone of voice changes, you become more stern or kind of short, they might notice that and it could cause them to escalate farther. The second thing is to assess your environment. So who's around you and are you alone with the agitated person? Is it safe for you to be alone with that person? Is it safe for anyone to be around? Depending on the situation, you might want to clear the environment. So this is going to be any patients, any other participants, any other staff, or any other family members. You want to kind of clear the area because we don't know how escalated the situation can get, and we don't want anyone else involved or in danger. Not only that, but if there are other people around, they might try to join in and de-escalate the person with you, and then that person might feel like they're being ganged up on. Another thing, and I'm very big on this, I always like to know where nearby exits are. Even if I'm at the movies or if I'm out and about, I like to know all of my exits. It's for your own safety. Also, in this situation, you have an escalated person that you're dealing with. You need to know the nearby exits to make sure that your environment is clear and everyone else can get out. But also, if you're alone with them and it's dangerous, you need to know how to get out yourself. Depending on where you're working, you should know where certain phones or if you use a paging system, if there's a phone in the room near you or however you would call the code in a facility. Usually there's a certain color code that you would call um, for any kind of dangerous situation or escalated agitated person, or a phone if you need to call into the facility and let them know, that this person's showing aggressive behaviors or the family member, but just knowing how to call for help. Then we're going to employ defensive body language. So we're staying calm, we assess the area, we're going to start to kind of show defensive body language. This does not mean that your defensive body language is in a stance like you're about to fight or have to defend yourself physically. This means maintaining a safe distance, especially if that person is hitting, kicking, biting. We want to stay at a safe distance from them so we don't get injured, and then using our arms to shield ourselves. So you can put your arms up, but make sure that your hands are open and visible. If you close your hands and your arms are up to defend yourself, it's going to look kind of like a fighting stance, and we don't want that. Also, if your hands are closed, they don't know what's in your hands or if you're becoming dangerous yourself. So when your hands are open and up and visible, it shows them you're basically just kind of there to help. You don't have anything in your hands to use against them, and you just want to de-escalate the situation. If possible, express your concerns and boundaries. So we want to let them know, I understand that you're upset right now. I understand that you're frustrated. I understand that something is going on. Maybe you don't know the emotion that they're showing, but obviously something is going on. You can let them know, I really want to help you, or I am concerned and would like to help you. However, I'm unable to understand you if you're yelling, or I'm unable to help you if you're hitting. So can we please take a breath so that I'm able to help you and understand you? Hopefully the person, takes a second, takes a breath. They can repeat the issue back to you, or you can let them know at this time, I'm unable to help you if your behavior continues this way. So if they're cussing at you, using profanity, if they're yelling at you, screaming, kicking, biting, spitting, let them know, unfortunately, I'm unable to help you at this time until we can take a breath and calm down and gather our thoughts appropriately. Then you want to ask questions. So, I'm here to help you again. Now that we've taken that breath, how can I help you? Or what triggered this behavior? Or however you want to word it, you're going to know the person that you work with. Sometimes you don't want to say, I know you're mad, because then they might get upset saying, I'm not mad. So basically kind of know the person that you're working with, but this is where you would want to ask, how can I help you? Um, if you know it's around mealtime, maybe asking them if they're hungry, if they'd like to eat a sandwich or whatever's for lunch. If it's a noisy environment and we know that that's a trigger for them, maybe we're asking them if they'd like to step outside or move to a quieter area. But basically ask questions so that we can propose a solution. Um, we don't want to argue or show that we're getting defensive, because again, that is just going to escalate the situation. We're there to just show basically empathy, understanding, that we understand that they're feeling the way that they're feeling, and we want to help them. So definitely we don't want to argue with them. And in some cases, we need to redirect them. If this is an Alzheimer's or dementia participant or patient, we definitely want to redirect them out of this aggressive behavior. But maybe you know that this is a busy environment, or the person next to them is talking too much. Maybe we ask them, okay, would you like to go watch TV, or would you like to go into this other room? Would you like to go for a walk? Maybe you're at home and the person is upset because they can't find something, so you can apologize that they can't find it, or it's not where it was. You'll look for it, but how about we go have lunch? So basically, you're redirecting them into focusing their thoughts on something else. And then get help. So if these tips and tricks on de-escalating the situation are not working and you need to get help, this is when you would need to know where your phone is, right? So that we can call for help. Maybe you're calling another caregiver or family member in. If there is more than one person there with the person that's escalated, don't call for help and then stay there with that person unless it's dangerous. And it needs to be two people, but only one should be speaking. If you called for help because you know your limit physically and mentally and you're unable to de-escalate, once the other person comes to start de-escalating the situation, then you should back out or tag out so that it doesn't look like you're ganging up on the person. Also, this could be getting help for future. So maybe, you were able to de-escalate them, you distracted them, redirected them, got them to calm down and watch TV or eat lunch, but you still need to get help in preventing future behaviors. So maybe discussing with the family member or the agency or your supervisor, just depending on where you work and the type of facility, just letting them know about the situation, the behavior that was exhibited, how you were able to de-escalate the situation so that you can manage those outbursts in the future. Again, limit to one person de-escalating at a time, keeping that friendly, positive, and using clear, simple sentences. If you're talking to someone that's using or having aggressive behavior and you're just repeating things or telling them more than one thing at a time or more than one question at a time, they're not going to hear everything that you're saying because they're agitated, they're upset, they're frustrated. They're either going to just hear the last thing you said or the first thing you said. So it's best to use clear, simple sentences saying one thing at a time. And then again, we're going to use the A in heard, right, which was acknowledged. So they told you what's going on. We're going to repeat the answer back to them to let them know that we were listening and to let them know that we have their concern correct. You want to focus on the feelings and not the facts. So again, this person was upset because someone sitting next to them was talking too much. Well, maybe that person literally only said good morning. Is that considered talking too much to us? No. But to that person, they were upset and they feel like it was too much. So we're going to focus on the person's actual feelings and maybe not the actual facts, especially with Alzheimer's or dementia, because again, their reality is not the same as our reality. And then limit distractions. So if this is in a home environment and we're trying to de-escalate a situation, we don't want to be washing the dishes while watching TV or there's a lot of noise going on, this is where we would want to stop washing the dishes, maybe turn the TV down or turn the TV off so that we can communicate effectively. If there's a lot of distractions and we're in an office or in a noisy environment, this might be to where we step outside, or we try to clear some distractions so that it doesn't further agitate the person. And then again, secure the area as much as possible. So you want to make sure that the area is clear from other participants, patients, staff, visitors. If we're in a day center, transportation is there, other family members are there for other patients. In a home environment, if there's more than one caregiver or family members, we want to make sure that it's secure and clear. And then, like I mentioned before, one size doesn't fit all. However, you can start with what's worked before. If you know this person, for some reason, likes Coca-Cola, and every time they get agitated or frustrated, you can redirect them with the Coca-Cola. Coca-Cola is not good for their health, but just the idea, if you know something that usually works with this person, maybe you want to try that first. It might not work this time. We might need to adapt or be more flexible in coming up with a different solution. But you can try what you've known worked before, especially if it's the same person. And then take a break. So you've de-escalated this person. Maybe you need to step outside and get some air so you can get your thoughts together. Go take your 15-minute break. Go to the restroom and kind of stretch for a second. But basically, you need to take a break, take a breather, so that you can go about the rest of your day and you're not just continuing to be kind of upset or stressed from the situation that you just dealt with. And then support or assistance. So again, this would be in the situation if you need help, or afterwards so that you can manage future aggressive behaviors with the person, or maybe, if this is because of some kind of issue that needs to be medically addressed, maybe we're discussing it with the provider so that medications can be adjusted, but basically whatever support or assistance you need with that person to prevent for future escalated situations. In conclusion, these de-escalation techniques, they're a skill that need practice. It doesn't come easy for some. Sometimes we need to practice. Sometimes, the way we handled one situation might not have been the best, but we can grow from that and learn from that. And then try to remember what works today might not work tomorrow. So again, you de-escalated them with a soda. Tomorrow they might not want a soda. Tomorrow we might need to redirect them into watching TV or eating lunch or going for a walk. But just try to remain flexible and adaptable to different situations. And again, you know your limits mentally, physically. So if you're unable to de-escalate that situation, get help. Know that it's okay to get help. And make sure that these behaviors are being monitored and tracked, and we're letting the medical provider know, we're letting family members know, or the agency know if we're working for an agency, so that we know the behaviors if it's progressing or escalating, or ways of managing that in the future. If you have any questions, you can go ahead and write them in the chat and I can answer those for you. If you don't have any questions, I thank you for being a part of the Managing Aggressive Behaviors presentation today. Your certificate will be emailed to you. Usually it takes a few days or a week or so once they verify attendance, but they'll send that out. I hope you guys have a really good week. Happy Monday, and hopefully you guys will be able to start working on these de-escalation techniques. Thank you.